John, did you want to begin?
Hello, my name is John Moyer, and I want to welcome you to the NIH Office of Disease Prevention's Methods Mind the Gap webinar series. This series explores research design, measurement, intervention, data analysis, and other methods of interest to prevention science. Our goal is to engage the prevention research community in thought-provoking discussions, to promote the use of the best available methods, and to support the development of better methods. Before we begin, I have some housekeeping items. You can submit questions during the webinar via the chat pod. You'll need to open the pod by hovering your cursor at the bottom of the Zoom window and then clicking on the chat icon. Please direct your questions to hosts and panelists. We will open the floor to questions that have been submitted via the Zoom chat pod at the conclusion of today's talk. The slides and video recording will be posted on our website, prevention.nih.gov/mindthegap, in a few weeks. Lastly, we would appreciate your feedback about today's webinar. Upon closing, you'll be asked to complete an evaluation. We would appreciate your feedback as it will help us improve this webinar series. At this time, I'd like to introduce Dr. David M. Murray, Associate Director for Prevention and Director of the Office of Disease Prevention.
Thank you, Dr. Moyer. Today's speaker is Dr. Melody Goodman. Dr. Goodman is the Interim Dean, Professor of Biostatistics, and Director of the Center for Anti-Racism, Social Justice, and Public Health at the New York University School of Global Public Health. Her research interest is identifying the origins of health inequities and developing evidence-informed primary prevention strategies to reduce these health inequities. Her research has been supported by the National Institutes of Health, the Robert Wood Johnson Foundation, the Verizon Foundation, Long Island Community Foundation, the Patient-Centered Outcomes Research Institute, and the Susan G. Komen for the Cure Foundation. Dr. Goodman has published more than 100 peer-reviewed journal articles and 2 books, Public Health Research Methods for Partnerships in Practice and Biostatistics for Clinical and Public Health Research. She is a fellow of the American Statistical Association and the inaugural recipient of the Societal Impact Award from the Caucus for Women in Statistics. It is my very great pleasure to welcome Dr. Melody Goodman.
Thank you all for having me today and having me back to talk about the science of partner engagement in research, development, and validation of evaluation metrics. So we started this work really sort of thinking about the science of engagement and trying to encourage our colleagues to treat engagement as a science. We wrote this commentary really asking people to write papers about how they were thinking about engagement and how they were evaluating engagement and how it was impacting the scientific process and scientific discovery. So there's an African proverb that says, if you want to go fast, go alone. If you want to go far, go together. And I think most people that do community engaged research really sort of hold true to this sort of proverb. But there's actually a great poem by Robert Fulghum called All I Really Needed to Know I Learned in Kindergarten. And as a biostatistician who stepped into doing community engaged work, people kept asking me, like, how did I know how to do this? And I think the general principles are things you know how to do. It's just, do we do them well? But I think some of these are really key. Share everything, play fair, put things back when you found them, clean up your own mess. Don't take things that aren't yours. Say sorry when you hurt somebody. And it's always true, no matter how old you are, when you go out in the world, it's best to hold hands and stick together. And that's really sort of the point of community engaged research. The challenge we had is, while we felt that this research was valuable, we had lots of anecdotal evidence from our own research, there was limited empirical work around what the real impact of community engagement is in the research process. And what we noticed is the extent to which stakeholders in research partnerships feel engaged had not received sufficient attention. And we thought it was important to understand how engagement level in a partnership was developing, and to what extent engagement is a level or predictive of the outcome of the larger study. We started by conducting a systematic review of existing measures. We thought that there would be several measures that existed because people have been doing this type of work for a while. We found that lots of people had measured something, but really didn't know what they measured. And the field just wasn't really strong methodologically. So in our systematic review, we really went through all the different measures that we could find and really looked through how they were validated in terms of if they were really measuring what they intended to measure. We found that measures came in two camps, one in which investigators simply counted things like attendance in various events and activities and assumed that that was engagement. So number of people who attended a community advisory board meeting, for example. And the other ways which investigators had measured some construct that was possibly related to engagement, such as the degree to which participants felt comfortable sharing their thoughts and opinions. When we took these types of measures to our community advisory board, what we found is that our community partner said, I could be there, I could attend the meeting, but that doesn't necessarily mean I'm engaged. Or I could feel comfortable sharing, but it doesn't mean that I'm actually going to share. And so while these were sort of good proxy measures, they weren't measuring exactly what we wanted. And then we found neither way had really been validated or corroborated. Most were not examined in relation to the outcomes or progress in the partnership or the project, and had not been tracked over time. Because we didn't find a measure, we started to develop our own measure that we were trying to evaluate the work of a cancer disparities research center. So this is not just research studies, but other types of partnerships that were for the benefit of research, but not necessarily research themselves, and other forms of community engagement. We did a literature review. We found 11 engagement principles that were developed in the literature and that we agreed on with our community partners, or ones we wanted to assess. And we developed 3 to 5 items to assess each of those engagement principles. We used Likert type response options, and our community partners really felt that it was important that we measure them on 2 scales: quantity, how much, but also quality, how well. And there was a real point around, you could do something a lot, but it not be really great. And you can do something one time and it be amazing. So in order to validate this measure that we've started to develop, we received some funding from PCORI, and we started with the Delphi process. And this Delphi panel had both academics, but also community partners with varying levels of engagement experience in research studies. And our first sort of thing we try to do is like content validation. Are we measuring what we hope that we are sort of measuring? And so I have to thank our Delphi panelists. This is several years ago, but we brought them to New York City in April, which is a great time to be in New York City. And then we kept them in a conference room with no windows for 2 days and talked about engagement. And they happily did that with us and really improved, I think, our science, and really improved what ultimately became the measure that was developed. The Delphi technique is a method for collecting and organizing informed opinions from a group of experts using an iterative process that's often used in survey development. It ensures that feedback is obtained from all sort of the participants and that everyone's voice is treated equally. It afforded us an opportunity to really do a stakeholder engaged measure development process, which probably should always be done, but I don't think is often done in research. We had 5 rounds in our Delphi process. Rounds 1 to 3 and round 5 were web surveys, and round 4 was an in-person meeting, but we also used polling software to collect some data. The responses were analyzed by the investigator team and then returned to Delphi panelists after each round and to get their sort of feedback. Subsequent rounds included items where we couldn't reach consensus on previous rounds, but they were also accompanied by anonymous feedback from the previous iterations. And panelists are encouraged to reconsider their previous responses, and if appropriate, to change their previous responses in light of the replies and comments from other panelists. But they didn't have to. And the eventual outcome of our Delphi process was to try to obtain consensus, which for us meant 80% agreement among the experts on the panel. We did not force consensus, and items for which consensus could not be reached were discussed at the in-person meeting. On day 2 of that in-person meeting with live voting, we reached over 80% consensus on all the items, but I think that's because I had the great idea to bring an editor into the room for these meetings, and someone who's really good with words versus me, someone's really good with numbers. was able to help us, I think, find the right language that helps reach consensus without being forced. We collected lots of data during our Delphi process, and we can review our papers. I'm not going to go through everything, but we really worked through a couple of things. And so as a statistician, I wanted to get to the items right away, but we had to work a lot on definitions. Making sure that we agreed on what each engagement principle meant was key before we could determine what items we were going to develop to measure those principles. And so we spent a lot of time doing definition type work that I don't think we planned to do, but I think that was key in how we reached consensus and making sure that we all agreed that we were trying to measure the same things. We collected a lot of data throughout each round for each item, whether it was changed, whether it was dropped, whether it was added or modified. We even did things where we moved items from one engagement principle to another. And we collected data on this across several rounds of the Delphi process. And it ultimately led us to help sort of reach consensus on what we thought the principles, at least, of engagement that our tool should align with. And we started with 11 principles that came from the literature, but ultimately for the research engagement survey tool, which we call the REST, we decided that it should align with 8 engagement principles. The first 7 are iterations of a few of the 11 that we had, but the 8th one was one that was newly added as part of the Delphi process. So the principles are focused on community perspectives and determinants of health, that partnership input is vital, partnership sustainability to meet the goals and objectives, to foster co-learning, capacity building, and co-benefit for all partners, to build on strengths and resources within the community or patient population, to facilitate collaborative and equitable partnerships, to involve all partners in the dissemination process. And the one that was added in the Delphi process was build and maintain trust in the partnership. And this really came through because our panelists talked about, like, you need trust to do all the other things, but that trust is such a core component of this, and that it was really something that we needed to measure. So after the Delphi process, we really worked on fielding the survey and trying to do some psychometric analysis. We had 4 waves of surveys as we worked through iterations of the REST tool. And you'll see many of the surveys were released July 2017, November 2017, March 2018, and then there was a big gap between the last survey. The last survey we knew was going to be our final iteration. And we did some cognitive response testing in between the 3rd and 4th waves of our survey data collection, just to make sure that people were sort of interpreting the measure as we wanted to interpret. It's cognitive response testing is think aloud, tell us what you think this item means, tell us how you're sort of coming to the response. We really wanted to get a sense if people were understanding the measure, if it was readable, if it was understandable. The preliminary results that came out of that was around literacy and interpretation concerns. And it wasn't that people didn't know the words, but how they were thinking about dissemination, governance, intellectual property, and capacity were different in certain circumstances. There were confusion on the question stem. So this is where we changed the question stem. I think even though I'm a survey researcher, there ended up being a couple of double-barreled questions and trying to reach consensus in the Delphi panel. So those were fixed. And then it became clear that we needed to add a not applicable option. As a statistician, I sort of fought this because not applicable to me is missing data. But there were some points where, like, if your project had not reached dissemination, to ask you questions about dissemination, they really don't apply. And so it became clear that we needed a not applicable response option. And so we modified the measure in response to the cognitive testing before we rolled it out. And then on that final version, we did a little bit of construct validity, or really correlative validity. It's hard to validate a measure for which no gold standard exists, but that's essentially what we were trying to do. And so our approach to this was to look at it in correlation with other measures that we thought it should be associated with, and see how it performed. And so we had a pretty racially diverse sample, although they were mostly females, and it was a pretty well-educated group who responded to these surveys. Our items, at least for each engagement principle, show strong internal consistency on both the quantity and the quality scale. While there was an option to remove some items, we decided to keep them all in the scales. We looked at our measure to sort of validate this measure. We looked at things that we thought it would be related to. So one of them was trusted medical researchers. So we thought that if we were really measuring engagement, that engagement should be measured with trust in some ways, and particularly within our trust engagement principle. We also looked at, there was a survey of community engagement. There's a tool called the PAIR, which is the Partnership Assessment and Community-Based Research, the Community Engagement Research Index, and the Coalition Self-Assessment Survey, particularly their trust subscale was used to validate our sort of trust domain. And then the Partnership Self-Assessment tool, which has many components: synergy, decision-making, benefits, drawbacks, comparing drawbacks and benefits. And we looked at this, as well as all of their other sort of components of the PSAT. And then there's also a Wilder collaboration inventory. We'd looked at all these items to actually use them for ourselves before developing the rest. So we knew that they existed. We knew they kind of measure things about engagement, such as partnership or collaboration, but don't fully measure engagement. And so the goal in our validation was to show that our measure correlated with these other measures, but not so highly that we were measuring the same thing, but in a way that suggested that we might be measuring something slightly different. We used Spearman's correlation coefficients and standard sort of interpretations of negligible, low, moderate, and high correlation. And so what we sort of saw was that there were a few items where the tool that we developed sort of negligibly or lowly correlated, but there were significant correlations. And I think this is what we were trying to get at is, yes, these are things that are associated, but not at a level where we're measuring exactly the same thing. And then we had a few more where we had moderate, but we didn't have any that were high. So we feel like in this sort of way, this sort of back of the envelope validation, that our tool is doing what we want it to do. It's similar to the tools that measure things that are sort of similar to community engagement, but not so much so that we think we're actually measuring the same thing. And then I think once you sort of get the measure, it's like, how do you actually evaluate community engagement research? So what are the strategies of community engagement, and how do we define and classify different levels of community engagement? So when we started this work, we sort of put this figure in that first paper that I showed you in the original first slide about getting people in the field to talk about their work. And we thought of it as sort of as a linear thing, sort of outreach and education, where the researchers are going out, but there's not much input from participants, consultation, cooperation, collaboration, and partnership. And we bin them based on the literature and got some feedback about people who disagreed with us. The interesting thing is when we started to look at our own data, we'd gotten some feedback about outreach and education and whether that was engagement or not, and what the level of engagement and why was that the lowest level. But when we looked at our data on how people scored the rest and how they classified their projects in terms of the definitions we gave them, we see that outreach and education actually has a higher level of engagement according to the rest than consultation, and in some cases than cooperation, but that then all the other categories have this sort of linear trend that we were sort of expecting. And so it made us rethink about whether it's sort of a continuum. And so I'm a statistician, I'm not that creative, so I just went from one axis to two. But I do think that it's important that we make a distinction between academic research output to non-academic partners and non-academic partner input into academic research. And while we think outreach and education is low on that non-academic partner input, it does potentially have a lot of benefit to non-academic partners. And so this is how we sort of reconfigured our thinking about the continuum of engagement, that it's not necessarily a one axis line, but you're doing things on both axes that can impact people in both ways, and we should be thinking about this in a bi-directional sort of way. And then, you know, as someone who does survey research, I know that if I want people to actually use my tool, that having an item, even though we got it down to 32 items, that people are not really going to use that. And so we work to develop and validate a brief version of the rest. And so we've developed a 9-item version to reduce partner burden. And we did several methods to determine that this sort of 9-item version performs quite similarly to the longer version, and used a bunch of different data around not applicable responses, the distribution of data, some preliminary item response theory and factor analysis. Even using some qualitative data from the cognitive interviews on how important and how difficult people thought items were, and some information from our Delphi panel to select the items that we were going to finally use in the brief version. We had a couple of brief options that we considered, but we settled on this 9-item version, which performs sort of really well relative to the full measure. And one that we see people sort of starting to use in practice. But in terms of internal consistency, the means and the medians, it performs really well and it correlates really well on both the quality and quantity scale with the full version. And even looking at the means and how they perform for the same data, looking at the sort of engagement principle level analysis sort of shows you that the results from the 9-item, although slightly different, are really quite similar to the full version, and so it could be used quite well in practice. And then I think it's great to have a funder who tells you your study is good, but you should add a new aim and not give you new money. But that's sort of what PCORI did. But I think the part that they wanted us to add, which is this implementation piece, is a really important part of the work that we did. This did sort of happen during the pandemic, and there's some challenges with that. But ultimately, we were able to get several teams to implement our measure in their existing studies and then evaluate how they felt about the measure and what they thought, et cetera. And so, we asked them about implementing the measure, what they recommended, how important they felt measuring engagement was, and really the feasibility of implementing the measure in their work. And most get fairly good scores. I think the things that we learned from the implementation phase was that team members indicated that they liked the measure and that it was a comprehensive, and that made it an attractive tool. They felt that it was straightforward to administer for them and also for their partners to complete. I think the challenges sort of come when, people want a good score or a passing score. And so the challenge for us was communicating to the teams about the fact that there is no cutoff point at which you're doing great engagement, that we really designed this tool to be more of a conversation starter for you and your team to talk about where you are in engagement and where you hope to go and how you hope to get there. And the rest sort of gives you some ideas about what you're doing well and what you're not doing well. We did have positive reactions to the results that we presented in categories along the continuum. People felt like their projects were correctly classified, and they felt like it permitted them to think about what they were doing and how they might do it better in the ongoing projects. We found that most teams agreed with their scores. We had one team that didn't agree with their rest scores, but they said they had recently had a disagreement with their partners. And so while they didn't agree with the assessment, they felt like it was probably their partner's honest response in that moment when they were asked to take the assessment, which was at a tense time for them in their partnership. And so I mentioned that this happened in the pandemic. We had many teams that initially signed up to do this, but then only half we could actually get to do it because people were having to transition and research remotely and all other kinds of things that happened during the pandemic, which we imagine were tense times for partnerships. So it makes sense that some of the partners were a little bit strained in that time. This work was funded by PCORI, which we're greatly grateful for, and don't blame them for any of our mistakes or our wrongdoing. And I really want to thank many team members who contributed to multiple parts of this work and of this project to get us to where we are now. I want to sort of talk about the rest sort of being used in practice. So where we are now is, we've finished developing the rest. And it's been an interesting journey working on this tool, because as we were developing it, people were using it, even previous iterations of it. And it's the first time that I've been working on something where people just felt like there was nothing else. And so they were willing to use even our sort of preliminary versions of it in their work. But it's also nice to start to see some papers come out that have used the tool in their work. So full disclosure, the first paper on here I'm a co-author on, and so it's a team that I worked on. It was a RADx up study where we used the rest as part of the engagement that we were doing for that study. But the other three for me are nice to see, because these are studies that I have no association with, didn't know they were going on. And it's nice to see people using the rest. We get many requests to use the rest. It is publicly available. It was created using PCORI funds. There's no fees to use. We'll have a website, which I'm happy to share in the chat when we're sort of done with this conversation. But we have a website that provides the tool. It actually, I think, has the recording of me doing this presentation a couple of years ago when we were first trying to get people to use it. Has scoring software and a bunch of data and resources for people who want to use the rest. The other thing I will say is that teams have really been adapting the rest for a variety of uses. So we developed it to be non-disease specific, non-population specific, just because we needed something that was going to generally work with our partners. And some of our partners are patients and community-based organizations, but we work with libraries, we work with other types of partners. And so we really needed a tool that was going to be generic. And people have been tailoring it. So there's a group that I know, I don't see that they published, but I know that there's a group that tailored it specifically to asthma, and it's shown good fidelity for that group. There's a group out in California that's using it to evaluate their sort of grant making portfolio, and have made some adaptation to use it in that capacity. And that's worked well. I'm sharing all these stories because I thought by now there would be a proliferation of measures to assess engagement, but there don't seem to be a whole lot. And so we've been encouraging people, if the rest isn't exactly what you need, to feel free to tailor it, to modify it, to adapt it. It's not going to be validated if you do those things, but to try to make it as useful to you as possible for your work, in lack of not having anything else to use. There are some measures I know specifically for patient engagement. And so if you're working specifically with patient populations, PCORI's also funded the peers measure, and that's been validated pretty well. But there's really limited validated tools in this space. And so I encourage you, if you're doing work, to publish in this area, but also we're not like beholden to the way we developed it. And so we encourage people to use it in a variety of ways. And so I know I left a lot of time for questions, but I usually get a ton of questions. And so I hope that that's okay with our moderator for us to head to the Q&A.
That is just fine. Thank you very much, Dr. Goldman. The questions have been coming in fast and furious, and so we're going to have an interesting discussion. A very basic question that several people have asked: who or to whom is this measure administered? Is it the research partners or stakeholders that fill out the form, or is it members of the study team? Is it participants in the study? Who actually completes the rest?
So we think the research project team should complete the rest. So not your study participants, but the people who are actively engaged in making decisions about the study itself. And we actually encouraged both academic and community partners to take the measure. I didn't show all of our data, but we even stratified our data to show project teams that often what the academic partners believe they're doing and how it's perceived by the community partners, there's a little gap, not always a big gap, but we think it's important for teams to really look at their engagement strategies. And so we encourage teams to take it in the beginning of their partnership, and even to take it longitudinally throughout their time working as partners, and to really be working on ways in which they want to improve their engagement approaches. I hope that answered the question.
No, thank you. Can you please say a little bit more about how you measure the quantity and quality of the items? What's the question prompt for those subscales?
Both of them have a really similar prompt. I'm sorry, I don't have the exact text, but it's something like, please state how well the leadership of the project do each of the following statements. And then please state how often the leadership of the project do each of the following. So it's like how well and how often, that's the sort of the question stems. And you know, we work with teams, some teams really focus on quality. There's no teams that really just focus on quantity, but often teams want to do a mix of both quantity and quality. In our own work, we've done both. We've tried to get it down to one scale, because I know that's the next question that's coming. Why do you do both? Our community partners really talk to us about this a lot. Quality matters, and so if I was only going to do one, I would do quality. But often you need also a measure of how often you're doing things and how thoughtful you're being about your engagement practices. And our community advisors, when we were developing the measure, really spoke about how both quantity and quality of engagement were important, and that we should be measuring both.
Thank you. The process that you use to develop the research engagement survey tool seems like a good case study in research engagement. If you were starting from scratch, would you change any of the steps that you used in the development and validation process?
I don't think I would change any of the steps. In fact, one of the things I've said is that if I ever develop another measure, even if it wasn't about engagement, that I would probably still use this engaged process to do so. I think it really improved our science. And I think when you're developing measures, you probably should have the population of people who are likely to take that measure involved in the measure development. I mean, it seems so logical when I say it, but I don't think that's often what we do as scientists, particularly as people who develop measures. And that was one of the things that I think came so clearly through to me in this process, was that I was likely doing this because I was doing community engaged research, and that's part of the principles of doing engaged research. And so it made sense to have it, but it makes sense that any measure we're developing should probably have a community engaged development process, because the insights that we got from the partners, we just wouldn't have gotten to where we were without them. And so it's hard for me to state in words how much they contributed to the science of the measure and the validation of this measure. And I really wouldn't develop any other measure, community engagement related or not, without using a community engaged process.
Thank you. I thought it was very clever of you to develop a brief version with only 9 items and to show that it performs well compared to the full measure with 32. Under what conditions would you recommend that researchers use the brief version, and under what conditions the full version?
So yeah, I think it depends on what you're trying to measure. And I didn't go into a whole bunch of detail, but we have 2 scoring scales for the rest. One that is aligned with the engagement principles, and then one that's sort of more aligned with the classifications, meaning like outreach and education, consultation, cooperation. And I think it depends on what the team wants to do, but the advice that we've given to teams is that you do the comprehensive version at least once, and then you do longitudinally, you sort of do the brief version. So I was on a team that we did the comprehensive version baseline, and then we did sort of brief versions longitudinally annually throughout the project. I'm on a team right now where we've actually discussed that we actually think we're going to do the brief version at baseline and the comprehensive version at follow-up, because we want that additional data at the follow-up time point about, for the brief version, you get pretty much one item. There's one EP where you get 2 items for the scale, and you don't get anything related to dissemination. So the brief version only has 7 engagement principles, and you really only get 1 item for each principle in that case. But if you're really struggling with one of your engagement principles, you probably want more detail on that principle versus, some overall number. So we really talk to teams about what is it you're trying to measure at what point, and really think through with them how to implement it. So I guess the thing is, there's no right answer to this, but to be thoughtful about what you want to measure, what data would be useful to you and your team at what time point, and to just think through clearly with the comprehensive version, you're going to get more detail and rich data on each engagement principle versus the brief version. But then there's a trade-off of time and burden and all of those things. And so I'm not going to answer the question for you. I created 2, use the one in the time and place that you think is most appropriate.
Leaving that judgment to the user then.
Mm-hmm.
This is a question that's going to probably prompt you to scroll back in your slides and put a paper up on the screen. Do you have a paper that summarizes the fantastic process for community involvement in measure development and validation?
I hear the person's point. I don't know that we have, because we put it into all of our papers. I don't know that we have a single paper that does that, but I think this paper here that I currently have on the screen talks the most about the strategies and how we worked with the partners to do the definitional work, which I think was sort of the more foundational components where we really relied on our community partners for input. I mean, we relied on them through the whole thing, but I think this is where their input was most prominent in the work that we did.
Great, thank you. It seems like high community engagement should be positively associated with health outcomes. Have there been studies assessing the association between community engagement as measured by the REST and health outcomes?
I don't think anyone has looked at it with like health outcomes in general, if that's what you mean. So no, I think teams have been implementing it in their specific studies. Often those studies have a specific health outcome that they are working on. We did develop it to be used for those types of, we developed it because we hope that people will start to use it broadly, to be able to compare one product, to see really how this improves the science and to elevate our conversation and our thinking and our empirical data in this space. We did have a team that used it and looked at different, they weren't looking at health outcomes, they were looking at different ways a partner could contribute. So like to the grant writing, to the data, like all of those things. And so I do think people are dissecting the measure in different ways, and there's a bunch of work in progress, but I don't know of anyone who's looked at it specifically with like a range of health outcomes, and that'd be interesting to see.
You're encouraging members of the audience to take a look at that in their studies. I have a question about how this tool would be used in trials involving multi-level interventions. Would you ask people at different levels to complete the research engagement survey tool? And this question may reflect some misunderstanding about who actually completes the tool. And your answer may be, well, it doesn't matter if it's a multi-level intervention or a single level intervention, it's the team that completes the tool. But you may have other comments on this. So would you ask people at different levels to complete the tool? For example, nurse case managers in a trial in which they play a key role in delivering the intervention.
So yeah, I think I'd ask all people who were sort of involved with conducting the study, but not people who were involved in like as participants. And when you mean different levels, so sometimes I think we talk about community partners, but we often go to the CEO of the community-based organization. I think it's important to have that person's view, but I also think it's important to have the field worker who's actually in the field collecting the data, or whoever is actually doing the work. And so if you mean different levels, like hierarchy within an organization, I think that's important. But like multi-level models, it's really the project team. So it's not necessarily about the study design, but more about the partnership structure of the project that I think matters more.
We have a question about perhaps psychometrics of the instrument. Are all the scores on the rest fairly high? In other words, do we know yet whether the rest picks up, variability in engagement, or are the scores skewed to one end?
I think there are some low scores. So people do report low scores. What you saw me report were averages. And I think on the average in our data, people report somewhere between like 3s and 4s on a 5-point Likert scale. I also think we had some selection bias in the studies that were willing to participate in the study that was going to come in and measure their engagement. In practice, we've seen lots of variability in REST scores. I think I also talked about that one team who didn't agree with their REST scores. Their partners rated them quite lowly on some items. There's some items where we do get high averages, but there's many items. So the items in the brief scales are ones that had some of the most variability because they could pick up a lot more movements in a single item. So I think it's a good question. I think the data I presented is fairly skewed, but that's not true of the rest in general as we've seen it perform.
Thank you. In a flow chart that you had on the screen, you listed tokenism. Can you highlight what aspects that tokenism played or plays?
So we actually pulled this from the literature, and then this is one of the things that got people talking about this. But I do think there are levels of engagement where you can have someone on a team, you can even have them in a leadership role, but you're not really taking their input. You just sort of have them in that position because it was going to get funded, or it was the way the project should be set up. And so I put this here because this was sort of controversial in the figures, not like it's not that we think consultation and cooperation are tokenism, but we do want to encourage teams to think about, are they doing it in a way that is really authentic and real engagement? Or are they just putting people in positions without real sort of meaningful engagement? I hope I'm making this sort of distinction clear that you can sort of have someone in a role, but you're not actually taking their advice. And so that's not really meaningful engagement in the way that we hope teams would do engaged work.
Thank you. A questioner asks about how the scores might vary over the life course of a study or a partnership. For example, they might be different during the development period versus the implementation period versus the maintenance period. Is the REST sensitive to these different phases, or can the items be tailored for the particular phase that the team is focused on?
I think, we have only really preliminary data. So in our implementation study, if I can find the paper, this one, we had teams that were in different levels of engagement, and we did 2 time points, so a year apart. And so what we noticed is that teams that were in their sort of initial development phases at the first time point, we could see a big difference in their engagement by the final time point. But teams that had already been doing sort of engagement work, while they actually could increase or decrease over time. So we didn't really see, for teams that were starting, we didn't see anyone go down in their engagement, so to speak. But for teams that were actively engaging, we saw teams go down and up. So I do think there are some, in the beginning phases, you do see, I think, a bigger jump in engagement from like not starting to actually doing things, and then also like a more positive trajectory of just like you're doing something, I guess. But then it seems that if you're not doing the right things, you will potentially either have a dip after that point, or if you're doing the right things, you'll keep sort of going up. I hope that makes sense. So it seems like all teams are gonna have a jump initially, like an improvement in engagement. I hate to say that because it's not really an improvement, but having higher quantity and quality of engagement. But over time, either that will continue to go up, stay the same, or potentially go down, depending on how partners perceive what's happening.
Thank you. A questioner asks, can the tool be applied globally outside the US?
So I think this is the major limitation of the REST as it exists now. I only speak English, Stata, R, and SAS a little bit. And so the REST is only available in English. And we have discouraged folks from doing direct translation of the REST. We don't think teams would have to do our whole validation process over, but we do think that if someone was going to translate the REST, that they should use a community engaged translation process. Because language was so important in English and for us to reach consensus, I have concerns about whether that will directly translate into another language. And so because I don't speak other languages, I just want people to be thoughtful in their translation of the measure. We're happy, like we had a postdoc that translated a little bit into Spanish and did some work with communities to do that. So I'm encouraging people to translate it, but to not just do a direct translation, to be thoughtful and community engaged in their translation process, just because the language was such an important component of how the rest came together, and direct translation doesn't always save sort of the intent or the meaning of the wording, if that makes sense.
I think it makes a lot of sense. And it's consistent with the whole approach that you've taken to the development of this instrument. Another listener asks, have you looked at the use of the tool for different groups of patient partners? For example, members of a rare disease community, or from the general wellness community?
I haven't, but it's being used currently in a bunch of PCORI and NIH funded studies across a bunch of diseases, including some rare diseases. So I haven't personally, but I know it's in progress. I haven't seen publications come out from that yet, but most of those studies are still ongoing. And so I expect in a couple of years, we'll have more information about that.
Related to this question and others, how do you track the use of the research engagement survey tool? And how do you know how it's being used in practice?
So I will say all of the things I'm saying are really anecdotal, but a lot of people reach out to us to either request permission to use it, and then we say, yes, and please let us know how you use it, and people actually write back. We've had teams actually share their data with us, particularly in the earlier phases. So I don't know everyone who's using it. There's probably lots of people using who I don't know, but there's been a large group of users who really engage with us to sort of help them either tailor it or share data with us. We're excited to use it and happy to report back. And so what I'm telling you is just is the sample of what I know from users. There's probably a whole universe that I absolutely don't know.
We have a philosophical question about how your team felt developing a survey for an endeavor that is fundamentally multidimensional, where a qualitative approach might have been better than a quantitative approach. Any comments or thoughts about that?
Well, I think we really took a mixed methods approach to this development. So we use both quantitative and qualitative techniques. We use, the Delphi panel. I showed you a bunch of quantitative data because I'm a statistician and that's the data that speaks to me, but we have tons of qualitative data, the cognitive interviews. And even when we were developing the brief rest, we did triangulation with both quantitative and qualitative data. I do think in terms of engagement, there are qualitative approaches that could potentially be better. I've used some of them, but they're often time consuming and not feasible for larger sort of studies and the things that we've been trying to do. And so I really think there's this balance of, what is appropriate for the study that you're trying to do to try to measure community engagement for a large cancer disparities center. Qualitative interviews would have taken us a long time to do, to try to get a good sample, to analyze that data, and then to be able to compare it to other centers. And so I really think that it's a trade-off, right? I think I'm not a statistician who doesn't appreciate qualitative data. I think it's immensely important. But I also think that if we're going to convince people that engagement is a science, we're going to need lots of different types of empirical data to support this hypothesis. And some of that will need to be quantitative as well.
Thank you. The questions continue to come in fast and furious. The audience is quite engaged in this discussion. Can this measure be administered to assess general engagement in partnerships? So partnerships that don't directly involve conducting research studies.
Yes, I'm struggling because we've done it with our partners that are not directly involved in research studies, but they are connected in some way to a research enterprise of that. So they are involved in, they're partners in a cancer disparities center. And so while they may not be involved in the research, maybe they're a library where we're disseminating information or working with someone. Like I said, we developed it to be generic. And so it is designed to measure people's engagement in a research project. But the type of partner, we're sort of agnostic to that, if that makes sense.
Thank you. Not exactly sure the meaning of this question, but because I could take it in a couple of different ways. The question is literally, did analysis include participants who have stigmatizing health conditions, for example, HIV? And I'm not sure if the questioner was asking about the development and validation process or in application of the tool once it was developed, but maybe you can speak to both.
We didn't ask a bunch about people's health conditions when they were sort of participating in our validation study of the rest. But we did, we did reach out to a bunch of research centers and asked them to send it out to sort of people in their network. And we did reach out to a bunch of health disparity centers and a bunch of sort of disease specific centers trying to get a variety of folks to participate. We don't know where people came from, so I don't, but we hope that we have a good sample. In terms of actual use, I think it's being used in a variety of populations. There's a team that's working on some HIV stigma research that I know has used it. I mean, I think it's being used across a broader range of case studies. What I don't know is how successful those teams, how much those teams like it or how good they think it fits to their population. I haven't gotten any complaints, but I also don't know that. I shouldn't say that. Academics probably would complain if they thought my measure would ruin their study, but I don't think it would ruin anyone's study. So I haven't gotten any complaints on the measure. We have had some critiques in the literature where people have taken it to their partners and they thought different things about it. And so that's another way we keep up with the literature, trying to see who's citing the work to see what they're sort of saying about it. And so I think different teams feel different ways, but a lot of people that we've spoken to, either they decided to use the rest out front. Some people decided to use it as outcomes in their study, which to me seems pretty interesting. But even the teams who decided to modify it, the modifications have been minimal and it's kept good fidelity. So like minor word changes in items or in things, but not actual changing items, if that makes sense.
Okay, can the rest actually be used as an outcome measure? For I can imagine it in dissemination implementation research, perhaps.
Yeah, there's an ongoing PCORI study I'm on advisory board for, and they're using it as an outcome measure as they're trying to develop engagement strategies and assess different engagement strategies.
You may have answered this question already, but how applicable is the rest to projects that are implementing time-limited or one-time engagement methods?
I think it depends on your research question. We've administered it cross-sectionally for sure, but usually in those instances, it was more to look at an association with. There was one study we were trying to look at how engagement related to study recruitment and enrollment and time to recruit and also diversity of recruitment. So it really depends on, I think, the research question that you're trying to answer.
You talked about using this tool at several different time points in a study that's going to last for a while. Do you have any recommendations on how often it should be used at different stages or repeatedly during a stage? Any comments on frequency?
So we found that in most cases, like if you have a multi-year study, that annually seems to be sufficient. You're not going to get a lot of engagement changes in short periods of time. Although if you've done something different, so like it's also like if you've done something different or if you try something new, you may want to trigger an assessment. So you have a pre-post type value. But we've told people annually in long-term projects and at most semi-annually. We don't expect that you'll see big changes quarterly, except for like in your initial engagement period. And I'm not sure how valuable those initial jumps are to people. So you need time to implement things and actually see movement. And so annually seems to be the way that I think most teams have been successfully using it. That being said, I think one of the papers I put up, the one we did with COVID, we were doing like quick, rapid assessments often, but that was part of what we were trying to do to measure our engagement during a pandemic.
Thank you. The REST seems like a tool that can be used with a variety of different teams or stakeholder groups. Can you say a little bit more about that? Would there be any reason to develop a version that's specific to one kind of team or stakeholder group?
I mean, I think there's, like I said, there's a team who did for just patients, and that's, that was their sort of main population. I think there's a decent measure for patient specific. For me as a community engaged researcher, I very rarely am working with the same type of partner always, and so it wouldn't make sense for my work. But if you're the kind of person that's working with one type of partner, then maybe that would make sense for the work that you're doing. But I think as we move ahead and take team science approaches, I think we're going to be bringing in multiple types of partners. And so I don't know, I mean, maybe I don't know, would you tailor a different measure for each group? I don't know. So I think it really depends on your research question. But when we developed the REST, we talked about this a lot. And we wanted to develop something that people could use widely and broadly and to be able to adapt to their needs, because we just felt that there was a gap and we wanted to help fill that.
Thank you. You have many thank you notes in the chat box, thanking you both for your work in developing this instrument and for this presentation. And you've also got a number of people indicating that they're going to use the survey tool in their next project. I want to thank you very much for a terrific presentation, very engaging discussion with questions, many questions from the audience. I will turn things back over to Dr. Moyer to close out the webinar.
Thank you, Dr. Murray, and thank you to everyone who participated in today's webinar. On the Mind the Gap website, prevention.nih.gov/mindthegap, you will find several resources for this talk, including the slides and a list of references. We will also be posting a recording of today's webinar on our website in a few weeks. Thank you and have a great rest of your day.